what's dementia? This is the definition that's in the DSM manual. It's actually called major neurocognitive impairment, but dementia and major neurocognitive impairment are essentially synonymous. This is cognitive decline from a previous level of performance, and you have to have impairment or dysfunction in at least one cognitive domain. So what are our cognitive domains? Well, there are 6 of them that we use in terms of diagnosing dementia. One is social cognition. Another is complex attention. Remember I was talking about the frontal lobes, how that's important for planning and inhibition. Attention is important there as well. Executive function, learning and memory. The hippocampus plays a very large role in memory. Language, our use of language, and perception, motor perception. Now, those are the domains we're talking about. You might have a little bit of impairment in one of those. That's not that uncommon, but to be dementia, it has to interfere with your everyday activities. So what does that mean? Well, I'm getting lost when I'm driving, or I'm leaving the stove on and there's been a big consequence from that, or the bills are forgetting to be paid, that kind of thing. And they can't be explained by something else. So there are lots of things that can cause us to be confused. Even, just an example, I don't know how many Jacksonville Jaguars fans we have here, but if you were watching the game last week and you got excited because they beat the Patriots, you may not have been thinking very clearly. You probably couldn't answer very complex questions if you're super jazzed up about something. It works the other way too. Anxiety can cause us to not think straight. Depression can cause us to not think straight. And in fact, sometimes we refer to cognitive impairment that's from dementia, that's from depression, as pseudo-dementia. So it becomes very important in determining whether someone is cognitively impaired from depression, because we got lots of medicines for depression, or whether it's from a neurodegenerative disease such as Alzheimer's disease. Very different treatments and very different prognosis as well. So, show of hands. Are dementia and Alzheimer's disease the same thing? Everyone that thinks yes, raise your hand. Dang, I thought at least someone would say yes. Everyone that thinks no, raise your hand. Nice. All right, so you're right. Well, I guess you're not going to learn anything new on this slide, but so you're right. All Alzheimer's disease, dementia is dementia. But not all dementia is from Alzheimer's disease. The way to think about it is Alzheimer's disease is a form of dementia, or Alzheimer's disease is the most common cause of dementia. It's the number 1 cause of dementia. And if you didn't know it, September is International Alzheimer's Disease Month, so it's kind of fitting that we're having this discussion in September. So this pie chart here shows you the neurodegenerative diseases that contribute or make up dementia as a whole, and you can see that Alzheimer's disease, or AD, makes up the biggest piece of the pie, but there are other ones in here. Anyone know who that is? That's right. Anyone know what he had? Alzheimer's disease, you're right. Anyone know that guy? Yeah. Any idea what he had? Lewy body. True and true. Yes, he had Lewy body dementia. Lewy body dementia is the number 2 cause of dementia. All right, that's a quiz point. So when we get to the quiz at the end of this, just make sure you remember.